Hi, this is Dr. Wayne Whalen with HelpWhatHurts.com. Today I want to try to address a question I hear once in a while from my patients about why do I have to come back? Um, the short answer is you don't have to. It's totally up to you. But there's a rationale for why we have to do treatment more than one time. So, just by way of background, I'm a co-author of clinical best practice guidelines for the chiropractic profession on neck pain, low back pain, chronic low back pain, and now chronic pain in general. And most of our guidelines recommend trials of 6 to 12 visits over 2 to 4 weeks. So those of us who are practice or try to practice in an evidence-based approach rely on these guidelines. So one caveat is I'd be cautious if you saw one of my colleagues and he told you right out the gate you need 30, 40, 50 visits or whatever. That is not consistent with the current literature, and you might want to try a different approach. So those of us who practice an evidence-based approach believe that patients need what they need, no more but no less. And it should be based on the best available scientific evidence and patient preferences. So it's a collaboration between the doctor and the patient. We both have to agree this is the approach we're going to take. So as I said, the typical approach is 6 to 12 visits over 2 to 4 weeks. If there's been no improvement, then the doctor needs to do one of a couple things. Number one, try something different, maybe a different chiropractic approach, different kind of therapy, something different. Maybe you need to have imaging studies. That's the point at which time maybe x-rays would be useful, or an MRI, or get a consult. Sometimes it's just that's not the approach that's going to work for you, and it's time to refer you to a different kind of provider. So the other thing is, if you are improving, then you should keep going until you either plateau, meaning it's not getting any better, it's stable, or your condition has essentially resolved. And then there's the subset of patients for whom they get lots better, they do great for a while, and then it kind of comes back. Why? Because they're still doing the same things that got them in trouble in the first place. So occasionally I have somebody who tries to tell me, well, I can only come in once a week. And I just tell them, look, that's a lot like being out of shape, overweight, and deciding, by God, I'm going to go to the gym and get in shape and go in once a week. What are you going to accomplish? Probably not much. So I'm happy to help patients do it, meet them wherever they are. And sometimes I'll agree to see people on that basis. But generally I'll tell them, look, when you're ready, I'll be here. But we need a little more commitment than that. So at any rate, I hope that helps answer the issue of why you have to go back more than one time. The patterns that develop from these musculoskeletal problems typically take time. And if you fell on the stairs last week and tweaked your lower back, it may take you a few visits, and that's about it. But if you're sitting at a desk all day with your at home with your tables too high, the monitor's in the wrong place, and you're reaching way out here for your mouse, wondering why your arm's going numb and why your neck hurts all the time and you're getting headaches, well, that's probably not going to go away in a visit or two, particularly if you're continuing to do the things that got you in trouble in the first place. So anyway, I hope that helps answer some of your issues. This is Dr. Wayne Whalen for HelpWhatHurts.com.